Good afternoon, and thank you again for joining us for today's webinar, Innovative Housing Practices for Healthy Aging in Place, a closer look at Pennsylvania Department of Aging's alternative housing pilots. Today's presenters are Brian McShane, Julie Fenton, Larissa Yusko, and Julie Seeby. Brian is a Senior Program Manager on the Metro team for the Corporation for Supportive Housing. Prior to joining CSH, Brian spent 7 years working in the Residential Services Unit for Philadelphia's Department of Behavioral Health. Prior to that, he worked for 8 years in direct services to individuals experiencing homelessness in Philadelphia. Julie Fenton is the Director of Business Development for the Clearfield County Area Agency on Aging. Julie has worked in the healthcare sector for over 25 years. She began working at the agency several years ago and was tasked to look at affordable housing opportunities for those who wish to remain in their community. She has also worked with the Pennsylvania's Department of Aging to bring the first ECHO elderly cottage housing opportunity to not only Clearfield County but to Pennsylvania. Larissa Yusko. Ms. Larissa Yusko is a Share Housing Counselor and has 26 years of work experience including education, marketing, small business ownership, and years 1 and 2 with the Share Housing pilot. Julie Seeby is the Chief of the Division of Housing and Community Services and has been with the Department of Aging for 5 years. She began as an Aging Services Specialist covering the Northwest region of the state. Her previous experience includes working with the Department of Human Services as a program specialist in the Medical Assistance Long-Term Care Policy Unit and as an income maintenance caseworker specializing in long-term care and waiver medical assistance eligibility. Thank you all for joining us, and thank you for our presenters, and I'm going to turn the presentation over to Brian.
Hi, everyone. Sorry, just took a second to unmute myself. So today we're going to be looking into a closer look at Pennsylvania Department of Aging alternative housing pilots. Before we do that, I'll probably do some stage setting with just what we know about trends in aging and homelessness. So today's objectives, we're going to obtain a better understanding of complex health, social, and long-term care needs of older, vulnerable adults and continuum of housing options available. We're going to analyze how specific social determinants like housing contribute to health promotion, stability, and self-sufficiency, and describe the purpose of various statewide age-friendly initiatives such as ECHO and Elder Cottage programs. We've already introduced the panel, so I'll just do another slight introduction of myself. Community Supportive, Corporation for Supportive Housing has been expanding work that we've been doing in Philadelphia area and Pennsylvania. So I'm actually the newest team member based out of Philadelphia and just really excited to get to work with all the partners here in PA. So if folks aren't already familiar, just a brief overview of what CSH does. We offer capital expertise, information, and innovation that allow our partners to use supportive housing to achieve stability, strength, and success for the people in most need. We advocate a supportive housing model that is permanent, affordable, independent, tenant-centered, flexible, and cornerstone of that is a voluntary engagement in services. There's several reasons that we see supportive housing as a solution for populations with multiple needs. Supportive housing is a solution for a population that, if it weren't for supports, they might not be able to live in affordable or dependent housing. But at the same time, if it's not for affordable housing, they might struggle to engage successfully with supports. Supportive housing is appropriate intervention for populations with multiple service needs and challenges to sustaining independent living. Around 80% of supportive housing tenants tend to maintain housing for at least a year. Their use of most costly and restrictive services and homelessness, healthcare, criminal justice systems declines when people are actually able to live in supportive housing. And supportive housing tenants choose to participate in services even when they're not a requirement for tenancy at pretty high rates. So where does supportive housing fit in the continuum of senior affordable housing? you see kind of a bunch of different options that are available. We know that there's various options, even though the stock of those options can sometimes be limited for people wishing to age in place. Where we see supportive housing in this continuum or hierarchy of needs is that it provides more supportive services and case management than your typical senior housing with services like a 202 or an ORC. But it's still independent living. As you go up this continuum, there's both a higher service need and a need for the rental subsidy, but we see it as successful intervention delaying premature placement in costly places like nursing homes. Especially for your most vulnerable, the homeless or currently institutionalized folks, given the multiple high-risk physical and behavioral conditions experienced by this group, the provisions of permanent, affordable housing linked to the comprehensive array of supportive services is essential. Housing is the first step towards stabilization of physical and mental health for many older, elderly adults experiencing homelessness. Without supportive housing, healthcare is likely to be received intermittently in emergency rooms or other crisis-oriented health facilities, which is expensive and often results in poor and fragmented care. Supportive housing is a proven intervention that reduces the use of emergency services, resulting in significant savings in public dollars, while providing the coordination of physical and behavioral health services that's essential for older adults. Supportive housing also reduces the likelihood that homeless older adults will be placed in nursing homes or convalescent care facilities. So our focus on aging adults and service needs wishing to age in the community. It includes adults over the age of 50. I'll get into why we kind of set that threshold later, that are experiencing homelessness or are inappropriately institutionalized, or currently aging in place in supportive housing who desire to age healthfully and safely in their own homes for as long as they can. Supportive housing should be seen as an ideal solution to address needs of aging tenants with adaptable housing models and flexible service packages. So what do we know about the aging population in like national trends? The U.S. is experiencing both a declining birth rate and an increased average lifespan. This means that it's reasonable to expect that individuals are living longer, but with less family and social supports than in previous generations. This combination will increase the percentage of people over 65 by around 20%, 72 million people by the year 2030. Also, according to census data, by 2033, for the first time, the population that's over 65 years old will outnumber people younger than 18 in the United States. The aging of the U.S. population is also expected to increase homelessness among older adults. So the chart shows the projection of elder homeless for folks that are 65 and older from 1990 all the way projected out to 2050. Please note that homeless individuals between 50 and 64 are not included, but we're going to talk about this group later on because there's a high prevalence of chronic conditions among that age group in the homeless population. The projections here suggest that the number of homeless elderly will double by 2050, from around 45,000 to about 95,000. The surge in older homeless people is driven largely by a single group, younger baby boomers. Those born between 1940s and 1965, as this group has consistently made up about a third of the total homeless population in the shelters in particular for the last several decades. So when we look at aging in PA, what we know is that the proportion of PA residents that are 65 and older will increase 53%. Will make up from 15% in 2010 to 23% of the population in 2030. 28.4% of renters aged 75 to 84 and 39% renters of 85 plus are severely cost burdened, which is about 50% of your income, I believe. So we've got 53,000 and change Pennsylvanians living in nursing homes, state hospitals, or state centers. If you transitioned just 500 of these individuals from nursing homes to independent living, like supportive housing, we project you could save about $15.7 million a year. So As the single largest expenditure in most household budgets, housing costs directly affects financial security. I'm going to go over some more in-depth numbers here, so have some patience with me because it gets a little word salady. Today, a third of adults that are age 50 and over, which includes about 40% of those over 80, pay more than 30% of their income for housing, and it may or may not even meet their needs, that housing that they're paying over 30% for. Among those age 65 and older, about half of all renters and owners still paying off their mortgages are similarly house cost burdened. Moreover, 30% of renters and 23% of owners with mortgages are severely burdened, paying more than 50% of income on housing. So that puts them at risk of severe risk of homelessness. For many older renters, securing federally subsidized housing is the key to financial stability, but few are fortunate enough to receive this assistance. In 2011, just shy of 4 million households aged 62 and over without children had very low incomes, or at below 50% of area median. So that's a common eligibility threshold for programs targeting the quote-unquote elderly. Of these, only about 1.4 million, or about a third, benefited from rental assistance. A large majority, 58% of very low-income households aged 62 or over without assistance face either excessive housing costs, live in severely inadequate units, or both. HUD-administered data indicate that 1.1 million older renters lived in either public housing or privately owned developments with unit-based assistance in 2013. So without getting too far into the specific numbers, I think what this graphic shows us is what we see is individuals that are 65 and older living in HUD-assisted facilities. The vast majority have either 4 or 5 or more chronic conditions. When we talk about chronic conditions, we're talking about longstanding health and mental health issues, things like high blood pressure, diabetes, but it could also go to even more serious health concerns like autoimmune deficiencies, or could apply to serious behavioral health issues as well. So we see a high need for services to help individuals who are experiencing multiple chronic conditions in this age group. So as the actual intervention of supportive housing ages, so does its longest standing tenants. National data shows that close to 40% of tenants are now over 50 years old. A lot of them are tenants that were housed potentially years ago and have aged in place. Some of them, though, are newly housed tenants coming from a homeless population that's also aging. So I think in a slide or two I'll get into what the biggest cohorts in the shelter population look like, and that's your feeder for supportive housing is also aging, as well as the group that's already in the supportive housing. So it's no surprise that given this changing tide that affordable and supportive housing developers and service programs across the nation are responding by designing and developing more projects and programs that are specifically targeting aging and elderly adults. Supportive housing providers are finding that they must view quality housing through an aging lens and deliver solutions that meet these unique needs. Homelessness and health are intimately interwoven. Poor health is both a cause and a result of homelessness. Research suggests that homeless adults suffer premature mortality and age-related medical conditions compared to the general population. Homeless persons have age-adjusted mortality rates 3 to 4 times higher than domiciled adults, and the proportion of homeless adults in their 50s with chronic disease is similar to housed adults that are over 65. So that's why we also try to keep our eye on that group that's also in their 50s, because the comorbidity of chronic disease is a lot higher once you reach 50 and you've been experiencing homelessness. Homeless individuals have higher rates of chronic illnesses. Most common chronic illness are like high blood pressure, arthritis, emphysema, asthma. But other common conditions could include things like diabetes, heart disease, and older homeless people are 4 times more likely to have at least one or more chronic illness than the younger cohorts in the homeless rate. We also see that geriatric conditions similar to people that are aged 70 and older in the general population occur with higher frequency in people 50 and older that are experiencing homelessness. So this means that people that are 50 and older who have been homeless are more likely to experience things like being a fall risk or having urinary incontinence or memory loss or just difficulty with basic daily activities. Older homeless people who have geriatric conditions are more likely to then be visiting emergency rooms more frequently, 4 or more times a year typically, and more likely to be hospitalized. There's some researchers like Josh Vanberger who believe that some older homeless people may be prematurely placed in institutions like nursing homes as a result of this. And I'm having a little technical difficulty on my end. Hold on one second, folks. I lost. Okay. So the following recommendations to support promising healthy. Oh, please skip 1 too far. No, okay. Sorry about that. The following recommendations to support promising healthy aging in place practices and the future supportive housing initiatives. Recognizing that aging homeless populations experience accelerated aging as a result of years and hard living on the streets and shelters. Create service contracts that provide a comprehensive and age-appropriate range of services that can be made available on site, like specialized outreach services, assistance with daily activities of daily living, 24-hour crisis response, physical health care, et cetera. Subject-directed care plans must take into account the interplay of the chronic, often co-occurring health conditions, along with the normal physical and psychological changes that come with age. Then we need to promote cultural sensitivity towards a diverse aging population and their beliefs and attitudes search changing. A study in New York by the Center for Urban Research showed that 44% of New York seniors are foreign-born and speak an estimated 170 languages. New York may be one of the more diverse spots in America, so obviously that's going to be different from place to place, but it still speaks to a need for culturally competent delivery of services. As the population in supportive housing ages, social engagement is critical to ensuring that residents can safely age at home. One of the things that we've been paying a lot of attention to in supportive housing is isolation of tenants and lack of social engagement. Robust social programs aimed at decreasing social isolation and malnutrition, as well as wellness groups that focus on chronic disease and the end-of-life care issues for aging tenants should be targeted to older residents and sufficiently financed. Finally, the ability to safely age in the community requires housing that is adaptable for individuals as long as they live. So before I turn this over to the other presenters, I just wanted to do a quick plug for the annual CSH Summit. Every year CSH has their summit, which does a cross-sector collaboration in partnership with leaders from many professional fields important to supportive housing. It includes healthcare, education, child welfare, workforce development, intellectual disability, justice reform, addiction, community planning, and others. This year it'll be in Indianapolis from April 30th through May 2nd. The early bird discount on registration actually just lapsed at the beginning of March. There is kind of a less than early bird price that will go through April 4th, and then it'll jump up between April 4th and April 15th with the deadline to register. So you can go to the website there, or it's pretty easy to just Google CSH Summit 2019, and it'll take you to the website and have lots of information. It's a great opportunity for presentations from places all over the states on what individuals are doing to address really challenging needs and address the folks that we're all working so hard to serve. So I think that does it for my bit. I'm going to hand it over.
Good afternoon. Are you all able to hear me?
Yes.
Okay, great.
Yep.
Thank you. Thank you all for joining us today. My name is Julie Seavey. I'm with the Department of Aging, and I'm really excited for you to hear what the department is working on with housing pilots across the Commonwealth. I just want to start out by giving you an overview of our division. The Division of Housing and Community Services was created in 2013, so we still are relatively new. One very important piece of information I'd like to share with you is the Department of Aging does not have any dedicated funding for housing programs. The only housing program under our division's purview is domiciliary or DOM care that you might hear of. We used an existing consulting contract and we repurposed it. Our division director at the time felt more could be done to assist with and advocate for senior housing. So we took the existing contract for training and we changed the scope. This allowed us to have greater flexibility for housing initiatives. So we have this brand new division and brand new ideas. So how do we begin? The division hired on 4 aging service specialists to work regionally, and I was one of the 4. So we really started running from the ground up. And what a better way to learn what's happening in the counties, to attend the meetings and see. So we went to our regions, we attended housing meetings in each region. From that, we were able to identify interested and engaged counties who really wanted to work on housing initiatives in their areas. And through this all, we've developed a process to initiate housing pilots. So let's talk a little bit about our process. So the first thing we do is we verify the need in the area. We check demographics for the county. We look at what's the population of seniors, how many senior housing options exist, what are the waiting lists, what income levels are predominant in the area. So we really take a good look at the area and the demographics. The second thing we do is we contact the Area Agency on Aging for interest. One thing we have learned is buy-in from our partners, the Area Agencies on Aging, is very important for our success. So we must have a willing partner to work with the department and our housing contractor. Our next step is to distribute a housing needs assessment to seniors. So how do you find out what seniors need and want? Well, you ask them. We complete a needs assessment to determine what needs and preferences, along with any barriers that might exist, that seniors in the area have. The results are then sent to our contractor, Diana T. Myers, for review and compiling. After that occurs, we convene a housing symposium or a town hall meeting. And this, we invite stakeholders from the community. We invite commissioners, human service agencies, developers, anyone who has a vested interest in housing, and we share the results of our housing assessment. The day is very structured. It begins with sharing the results of the needs assessment in the morning, followed by a presentation of alternative housing solutions to get everyone thinking outside the box. The one thing that we love to do here at the department is think outside the box. So in the afternoon, we have breakout sessions, and they are meant for brainstorming ideas on how to find solutions for the problems identified from the housing assessment. And then we develop the project, and the work begins. So now we would like to go into detail about what we have been doing in the Commonwealth to address housing issues. Our goal is to pilot these programs and replicate to other counties. We are always looking for new, innovative projects that focus on the housing needs of seniors to allow them to age in place. So we're going to be taking a closer look at SHARE. Shared Housing and Resource Exchange, which is now operating in the Pocono region, Pike, Wayne, and Monroe counties, and ECHO, Elder Cottage Housing Option in Clearfield County. So at this time, I'd like to turn over the presentation to Larissa Yusko, who will talk about our SHARE program.
Good afternoon. Can everyone hear me?
Yes.
Fabulous. So let me give you a little bit of background about the SHARE Housing Program. We are in a 3-year grant funded pilot program. We started in June 2017, so we're in our 21st month of the pilot. Share Housing was designated as a pilot for Pike, Monroe, and Wayne counties to address the following issues in our community: lack of affordable housing options, rising property taxes and home maintenance expenses, including development dues, which are very predominant in this area, seniors feeling isolated in their homes. We cover a large rural area. Single participants and widowed participants needing for assistance with chores in their homes, and having an alternative to institutionalization if people can still remain living at home. Just so everyone's clear, there are many different types of shared housing programs throughout the country. For our purposes, our definition is as follows. Shared housing is a housing option in which unrelated individuals share a home to their mutual benefit. Unlike other housing models, such as group home or congregate living, shared housing is characterized by control, choice, and a mutual agreed-upon exchange of services if appropriate. I'd like to emphasize that it's choice in our program. So as I said, we started in June 2017. Myself and my partner, Ryan Lohman, were hired. Our responsibilities include assessing intakes, which are typically done by phone, completing applications, which we do in person, conducting background checks and reference checks, choosing and creating the matches, introducing the potential matches to each other, monitoring trials, negotiating and implementing match contracts, monitoring and counseling of ongoing matches. We continue to be the counselors for the matches as long as they are intact. We also do community outreach and education of the SHARE program. Since it is a brand new program in the state of the Commonwealth, we did a lot of outreaches in the first year to make sure everyone was aware of the program and understand it, and to pass the information on to their clients. So for our program, our guidelines are as follows. The house must reside in Pike, Wayne, or Monroe County. Anyone can apply in the program from outside the counties or even outside the state, but they have to be willing to live in Pike, Wayne, or Monroe counties. Anyone can apply for the program that is over 18. People get a little confused because it's through the Department of Aging. They think that both persons have to be over 60. That is not true. One person needs to be over 60 in order to make a match, but anyone over 18 can apply. The sharer must have their own designated bedroom, and the sharer can only be charged 30% of their income, and that includes utilities. So no matter what their income is, if their income zero, then we charge them, $30. I mean, $0, excuse me. So it really depends on how much they make, how much Social Security they have, and what they do for a living. I also like to add that the person that's over 60 could either be the homeowner or the home sharer. It is not designated that the homeowner has to be over 60. And we do a written agreement that identifies the rent amount and the exchange of services, or a combination of both. We're very specific on that in our agreement. So the top 4 reasons that people participate in shared housing. The first one being companionship. If the person does not want to live with another person, they're probably not suitable for our program. We do find that occasionally we have people that are desperate for changing their housing environment and they want to be a part of shared housing, but really their choice would not be to live with someone else. We have a discussion with them to make sure that this is going to be a long-term solution to their situation. We also, services are another important reason why people want to participate in shared housing. I would say that the 3 most popular services is driving, cooking, and yard work. And then financial reasons. This benefits both the homeowner and the home sharer. The homeowner helps with taxes and finances for them, as well as the home sharer finds a more economical living situation. And then security. Many people do not feel comfortable living alone, either for in case of an accident or injury, or for the sound of mind that they live with someone else. So this is our process. Once Ron and I do an intake over the phone, we ask them specifics to make sure they're appropriate candidate for the program. If they are, then we make an appointment to do an application. We do that application either at the person's home where they're currently living or a public location. It usually takes about 45 minutes to an hour. We find out a lot about who the person wants to live with, what are their choices, what are their finances, and we ask specifics about things like drinking, smoking, pets, would they prefer to live with a man or a woman, what age person they'd like to live with. It's very in-depth so we can find the perfect match for them. After the application is done, we do screenings where we do the criminal background checks and we check references. We also do a home inspection. Each home needs to be appropriate in a healthy environment. If not, then we make referrals to the community to help them get their home to the level which we need it to create a match for them. After that is all done, we look over and see who would be a good match for the 2 people. If we find that 2 people, when we find 2 people that are a good match, we introduce them, typically at the person's home. If the host home, if they get along, then we choose to do a trial. The trial usually lasts a weekend or a week, or we can actually do multiple trials. It's kind of as Ryan would say, my partner would say, it's a try before you buy. We want to make sure that the people get along in a living situation for a couple of days. If the trial goes well, then we sign a contract. It is a written home sharing agreement. Either party can end the contract within 30 days written notice. We are very specific about the rent and about which chores each person is responsible for and any other specifics that a person chooses to put into the contract. We also like to say it's a living document that if there's any changes that need to occur, they can address us, one of the home sharing counselors, and we can make adjustments to the agreement. And as we go on, as the match goes on, the shared housing counselors do check-ins, and we monitor, and if there's any issues, we're there to facilitate anything that needs to occur for that match. And then we will help with the termination of any contracts. The challenges we've had to date are among getting enough qualified applicants to make a match. Unfortunately, sometimes people have high expectations and aren't very good at compromising, which makes it for them not being an appropriate candidate. Issues that we've had is homeowners wanting a lot of money for the room that they're offering, or home sharers that have no money and not having enough people that want someone for no money into their home. We've had issues with pets, people having lots of pets, multiple pets, and wanting to find a match, or transportation. Some of our rural communities are not on any transportation lines, and that makes it difficult to have someone move into that home. Other problems we have are making sure that the home host and sharer really wants to share a home. As I said earlier, sometimes people might be desperate and they think this is a way out to help their financial situation, and but they really don't want to live with someone else, and that would not make a good match. And we occasionally have people that have mental health diagnosis that might be severe or might not be continuing with their therapy, and makes it a difficult match. And last of all is making sure, especially with our elderly population, that their families are on board. A lot of times we get phone calls from the children of a family member that want their parents to be in the program, and sometimes the parents initiate being involved in the programs and the children do not want them to be involved in the program. So making sure that the family's on board is very important. As for the share statistics, actually we have updated statistics from February 28th of this year. And up to date, we've had 18 matches, and we've done 155 post applications and 196 sharer applications. And here's our contact information. And next we have Echo.
Good afternoon. My name is Julie Fenton. Can everybody hear me?
Yes.
ECHO stands for Elder Cottage Housing Option. The background that I'd like to share is that we began working here at the Clearfield County Area Agency on Aging with the Pennsylvania Department of Aging in January of 2016 on some different housing initiatives. Julie Seeby had mentioned earlier about reaching out to Area Agency on Aging and looking to see what type of housing needs and aging populations were in the counties that the Area Agencies on Aging are in. We actually took up with the Department of Aging and got on board, knowing that Clearfield County has one of the highest elderly populations in the state. 18% of the population is over the age of 65, and 8.5% in Clearfield County is over the age of 80. Pennsylvania is actually has the seventh oldest population in the United States. So it's a state that is aging. We felt that there was a need for more affordable housing options in Clearfield County. ECHO is not a new concept. Back in the 1880s, Amish people, as they still do, and back in the 1900s, people lived together from birth to death. So we felt that ECHO would be a great opportunity to bring to Clearfield County. The tiny house movement spurred the ECHO concept. So as I move through the slides, we'll talk a little bit more about what ECHO is. It is a small, separate, manufactured residence. It is accessible, and it is temporarily placed on the side or rear yard of the host family. It is movable and reusable. It is on wheels, but what it is set on pilings while at the host family's home. So it's just not plopped on the property without some guidance as to how it's going to be secured on the property. The amenities that it has is it does have an open floor plan. It's usually 1 bedroom when we were looking for something. It has a living and dining area. It's wheelchair accessible with its bathroom and the doorways in the home. It has a kitchenette and a utility room that you can hook up washer and dryers to. It can also be set up with smart technology so that someone could live in the cottage and age in place until they would pass. Families and individuals that are served, we looked at, because we are an area agency on aging, is adults that are 60 years or older that wish to age in place. We know that national studies by AARP indicate that most older people want to remain in their own community and they want to age in place. So this, we believed, was the perfect option for some people. The consumer must be able to live independently with or without long-term care services and supports. The host families have to be related by either blood or marriage, and the families must agree to place the cottage on their property. Some of the responsibilities, one, with the host family, they have to perform property maintenance. They also have to allow inspections on a set schedule, meaning that we can go and make sure that the house is still in good condition, that the property that it's setting on has not deteriorated. And then there is an agreement that is signed between the host family and the agency. The consumer has to guarantee in verifying what their income level is. They have to pay rent, and they have to keep the cottage in good condition. Again, we look at doing quarterly to increased inspections if needed to make sure that the consumer and the host family are meeting these responsibilities. There is a lease that is signed between the consumer and the agency. So there is actually 2 pieces of paper that are signed, one between the host family and the agency, and one between the consumer and the agency. And then we do an annual income recertification, looking to see if the income level of the individual has changed. We look at 30% of what the income level is, and that is what we charge for rent. Some of the challenges and the lessons that we learned is one of the things that I learned very early on in this process is about zoning. Clearfield County happens to be a county that does not have many regulations in regards to zoning. However, the township that our Echo Cottage is placed on has many zoning regulations. So one of the major things that I had to do is educate and teach the zoning township board about the Echo Cottage and explain to them that it is a temporary dwelling, that we didn't need to split the property or subdivide the property, and that they would be somebody that would have the first elder cottage placed in their township in the state of Pennsylvania. I continued to use that throughout my conversations, and that seemed to get their attention a lot. With zoning, one of the things that I found is that there are different ways that a elder cottage could be placed in an area that is zoned. They can develop a special exception for their current zoning ordinance just to regulate the siting and use of the elder cottages. They can draft a separate ordinance to allow the cottage there with special conditions, and this is what the township did that I worked with. So every 2 years, what I need to do is go back to the zoning commission of this township and explain that the Echo Cottage person is still in. Here are the inspections that we've done, and here is how it's working for the patient. or the consumer that is there. There were some uninspected costs because this was a pilot program. We did receive grant funding from several sources, but we did incur some unexpected costs. We did need to do a driveway for this cottage to bring it up to the backyard of this individual, the family's home. So that was some unexpected costs. When you see some of the pictures, the kitchen and the living room design was not exactly of how we would like it. The kitchen is a little larger than I would expect, and the living room is a little smaller. And the biggest thing that I can say is that knowledge is key. The more that we can learn about what is expected in different townships and boroughs and cities, about what can be placed there, is absolutely key. It was a learning experience not only for myself, but it was also a very big learning experience for zoning officers and city council people, because this is such a new concept. So I was very pleased when the township was willing to step outside of their comfort zone and their box to bring this elder cottage to their community. One of the things that I need to say is the gentleman moved in. He was in a high-rise here in Clearfield proper. He originally is from California and was always used to opening his door and smelling the flowers and being able to feel the breeze. When he lived in a high-rise, he opened the door and he saw the elevator. So this was something that was a blessing for him, to be closer to his family, which is actually about 30 minutes from where he originally lived in the apartment complex. So now he's in the backyard. He has his independence. He had been taking anti-anxiety medication because of the fact that he lived in an environment that was really not something he wanted to do. And his anxiety medication since moving into the elder cottage has decreased. He has not gone to the hospital, and he is able to have his dog with him, and he is able to open the door and let his dog roam the property where his son-in-law lives. It may not be for everybody. It's another option for families who wish to explore alternatives in placing a loved one in an institution. And it is found that seniors that interact with family have longer, healthier, and happier lives. They're less isolated. I'd like to share some pictures with you. As you notice, this is actually the front of the cottage. We worked with the family and also the individual that lives there, and he requested, because this is the front of the cottage, to have stairs. He did not want to have the ramp placed in the front of the cottage. So you will see the next couple pictures, you will see the ramp in the back of the cottage. And it is well landscaped, and he looks out on a grove of trees when he opens his front door. So you will see that the ramp is on the back of the cottage, and there's a different angle to the front, and then you will see a picture of the ribbon cutting. The gentleman is there with his walker in his cowboy hat, and was pleased that this was going to be his until he was unable to use it any longer. These are a few pictures of the inside, the kitchen, the bathroom, which we have added because he wanted them, is bars. Initially he did not want them, but he found that he wanted bars to be able to, around the toilet. And then there is a handicapped shower. The doorways are wide enough in this home that if he would end up in a wheelchair, he could get through. And I reach out to him at least 2 or 3 times a month just to make sure that he's doing okay. And he has been doing very well. We are in the process of hopefully being awarded within the next month or two some more grant money for a second cottage that will be in another township here in Clearfield County. That township will be a little easier to deal with based on the fact that they do not have any zoning regulations in that township. So I guess the biggest thing that I can say is it is not for everybody, but it is an option for those that wish to age in place and be with their families. Thank you.
Okay, so I think we can open things up a little bit to questions. There were some great questions that came in through the chat box on the side, and I just want to circle back to a few of them, and then folks can continue to ask for the remaining few minutes we have. One of the first questions I saw, I think Julie Seavey, this might be more for you, was whether or not there are any perspective for opportunities to expand into other counties with these programs.
Yes, we are looking to expand to additional counties. In December of last year, we had a presentation to our area agencies on aging, letting them know about what we're doing in housing. And a few of them have come forward that they were interested in bringing share to their areas. In response to that, we applied for some funding that was available, and right now we're waiting to hear what our funding award is. But what I would like to do is encourage everyone, if you're interested, reach out to me. My email address is on here and my phone number, and I'd be more than happy to speak with areas that are interested.
Great. There's some very ECHO-specific questions that came in, including, you addressed this to some extent, Julie, but were there zoning opposition issues that you faced with ECHO? I know you talked about having to get special ordinances and things, but was there opposition that you faced?
I did not face any opposition. The opposition that was originally was that they did not understand it. So the education piece of understanding what the Echo Cottage was and how it would impact a family and their loved one to be closer together and not have to place in an institution or was the biggest obstacle. We had many meetings. It took about a year to get the zoning exception through, and we had they had an opportunity for people from the community to come in and ask, and there was no one that came to that meeting. So we did not have any opposition. It was the opposition of the people on the zoning board that did not understand the concept. And when they finally got it, they were all for it.
Thank you. There were some additional questions just clarifying the relation between the homeowner and the cottage individual. The one question was whether or not the relation requirement was just that everybody in the home was related, or whether or not somebody in the home had to be related to the person that would be in the cottage.
Somebody in the home needs to be related to the person that is living in the cottage, whether by blood or marriage. This person actually is, his daughter lives in the home that the cottage is on.
Right. There was a question about whether or not the relation requirement was because of zoning.
No, that was not part of it. That was something that we decided would be beneficial because we have seen in our work here at the Area Agency on Aging that families have a lot of windshield time to take people to appointments and grocery shopping and visiting. We felt that it was important that families be together. So it was not a zoning issue.
Okay. There was additionally just a question of whether or not you think ECHO can work in urban areas, or is it more likely to just work in rural areas?
I truly believe it can work anywhere. I mean, it's a matter of having people think outside the box. We did not know that whether it was going to work here in Clearfield County, but we have found that it to be very, very successful. So any zoning issues or concerns, I do have the ordinance that they wrote, so I would be glad to share that with people.
Great. Who actually owns the cottage?
The cottage is actually one of the things that we have unique here in Clearfield County at the Area Agency on Aging is Clearfield County AAA has a subsidiary that is called Mature Resources Foundation. And what they are, it's a nonprofit organization that is affiliated with us here at Clearfield County AAA. And it supports the AAA's mission of providing comprehensive and high-quality services to the elders in Clearfield County. So the role of that is to promote and further the economic development and the growth of Clearfield County AAA. So in actuality, Mature Resources owns the cottage. And if this gentleman in the future would need care and services, then potentially the Area Agency on Aging, through the services that we can offer, we can provide those services through the Area Agency on Aging. So Mature Resources owns the cottage, and the individual that pays rent will pay rent to Mature Resources.
Great, thank you. How is the site work paid for?
What we did was when we wrote our grants, we got a fair grant from PHFA and some local Clearfield County Affordable Trust grants, and all of that was written into the grants. And one of the things that the township required us to do, because we are responsible since we own it to remove it, is that they wanted us to set up a bond that for whatever reason, if the Area Agency on Aging went out of business, that the township would not be responsible for removing it. And usually the Echo cottages last for about 5 years, give or take. So the gentleman, if he is there for 10 years, is fine, and then he passes away, then we actually put into the ordinance that we had 3 months in order to remove the cottage and place it somewhere else.
Great. Colleen, I'm looking at the clock. I want to be mindful of people's time. There's a few questions left to get to. I'm wondering if I could maybe copy them and try to see if we can answer them. And is there a way to disseminate to the participants maybe after the fact?
Sure, we can. If you want, we can try to get through some of them, and yeah, you can follow up via email.
Okay, I'll keep plugging along for a little bit then. There's still more on Echo. People are interested.
Okay,
so
that's fine.
One specific question that was asked was about how the issue of water hookup is handled.
That is part of we wrote that into the grant. You do have to have a very committed family. I will have to say that because we had some others that were interested and the families were just kind of hands off. So you do have to have a very committed host family.
Right. So there was a question about whether or not the home needs to be a total separate dwelling or whether it could be attached to someone's main home, act as almost like an in-law suite rather than a separate home. And then there was that same individual wanted to know if there was flexibility to do something that like excluded a stove or whether there have to be certain elements that make it a dwelling.
There does not. We have made it a separate dwelling because we feel that the individual needs their privacy based on all of the information that we got at our town hall meetings when we did them 3 years ago. So we found that the separate cottage was the best option to go to, but there is nothing that says that there has to be a stove in there. It could be just maybe a mini kitchen, and then the individual could go down and have meals with their family.
The conference is now in listen-only mode.
Hi, sorry, we just had a technical difficulty. I'm just going to bring everybody back. Sorry about that. Julie, I brought you back. Sorry, it may have cut off the last couple sentences.
That's all right. I did. We did not. The attachment. What I was saying is that we went with the unattached because the person needs to have their privacy, but they could have a mini kitchen and then eat and be a part of the family if the family wishes. It is pretty much an open book as to how they want that to do. Great,
thank you. So for the share program, so Larissa, this is more for you. Julie gets a break. There was mention that homes with deferred maintenance or other issues are referred to the community for repair. Is this done by volunteer services, or is there funding for assisting low-income seniors with repairs to be eligible for the share program?
This is Larissa Yusko. I can handle that question. We service Pike, Wayne, and Monroe County, so each county is different what services they have to help elderly people that have housing needs. Luckily, we have not had a lot of call for that. But to give you an example, in Monroe County, Habitat for Humanity does rehabs on houses that might need some minor repairs. I hope that answers your question.
Great, thanks. Sounds like we're bouncing back to Echo. There was an additional question about whether or not there was a plan to expand it to non-related individuals, similar to SHARE.
We have not looked at that at this point. We are still looking at having the host family and the individual living in the cottage be related.
There was an additional cost. You kind of addressed this a little bit, but I don't know if this is in the grant as well, but who covers the cost of septic tank or sand mound issues?
That is actually part of the grant. That I didn't mention that the Echo Cottage is hooked directly into the septic and the electric or the water of the host family, and that is
cool.
We paid that through a grant.
Okay. There's questions about where the 5-year length of time on the cottages came from.
I'm sorry. The 5-year, usually cottages last about 15 years. I misspoke. 5 years is about as long as a person is in one. That's an average. Okay. So I apologize.
Okay. Back to Larissa, back to some share questions, I think, that'll round this out. There's just so that you know, I think we'll try to organize this. There have been a lot of people echoing that they are interested in seeing the ordinance, Julie. So we'll see how we can get that out to folks.
Just let me know who I need to send it to.
Okay. Yeah, Colleen and I can talk, and we'll figure it out. So back to Larissa, there were some questions about share. What would you say the biggest learnings from the housing model from the perspective of successful pairing have been?
I have to say that share housing is not for everyone. I think when we first started it, we were kind of pie-eyed that we could find a match for anyone. But, the sharer that has 10 cats and wants to move into someone else's home, I'm not going to be able to find a match for that, or at least not, in my lifetime. So that would probably be the biggest lesson we've learned.
Great, thanks. And then there was a question on who collects rent and if the host family gets any of the 30% payment.
The host family gets all of the payments, and Ryan and I do not, the share housing counselors do not handle any of the finances. That goes directly from the sharer to the host. Now, if there's a problem where someone is not paying or there's a change in the payment, then we get involved to counsel them, but we do not handle any payments.
Great, thank you. From what I can see, that's all the questions that people put into the chat box. I don't know if anybody has anything additional. But we are a little bit over time. So
Great. Yes,
one
thanks,
big
Brian.
Yep.
I just wanted to follow up and thank you all for presenting. Yeah, we are a little bit over time, but I really appreciate everybody staying over time to answer these really important questions. We have been recording this whole time, so anybody who had to drop off will be able to access the recording and listen into the additional questions that were asked afterwards. But I want to thank everybody again for joining us, and I want to thank our presenters again for sharing all of the information. And we will definitely be following up with the recording, the slides, and the ordinance information that we were talking about. So I want to thank Brian, Larissa, Julie, and Julie again. And thank you all again for attending, and I hope you have a great rest of your Wednesday.
Thank you.
Thank you.
Thank you.